It is a whole new game that you're talking about when you start to understand and change definitions, such as pain is not punishment, it's protection. And then you have to ask, what is it protecting you from?
Hmm.
So in many cases, I think there's always unique ways you could look at what it may be protecting you from or signaling to you that you require change. But what are some of the common patterns? Because everyone's going to have a unique set that leads them into the pain. What are some of the common patterns that you're seeing?
Yeah, so that's great. I mean, it's a great point that you made there, and it's that pain is contextual first, which means that it means something different for everyone.
Yeah.
Because what could be painful for you is not painful for me. So pain in and of itself is always subjective,
Mhm.
not objective. There's no way that you can quantify that. We try to with where does this sit on a scale of 1 to 10?
Right.
But my 2 could be your 10
Yep.
based on my prior experience with pain. Maybe I'm a Navy SEAL and I can deal with a lot of stuff and you're not. That makes a big difference on
Huge.
your outcome, right? But then it's also important to realize that pain only tells you that you have an issue or a problem. It doesn't tell you what it is or where it is. And that's where the stop chasing pain model came from. And I tell people, notice it doesn't say stop treating pain. It means don't chase it. And what I mean by that is that you look wherever somebody points. My shoulder hurts here, my hip hurts here, my knee hurts there, right? And then first of all, I'm going to ask, why are so many places hurting at one time, right? But it's logical to start there, right? Because maybe a zebra is a zebra, but sometimes a zebra is an elephant, which means it's not that. But if you treat where it hurts and it gets better, well, that's awesome. That's great. That's what you wanted to happen. But very often, it has a tendency to do this thing, which is called coming back over and over and over again. Then you have to figure, okay, well, I'm overlooking something here. Right. And then I just started to look, you know what? Well, let me just look everywhere else. And then maybe I'm going to find an area that you're not looking at that's not painful on you, but is contributing to that area of pain. So, say, for instance, it was your right shoulder that hurts. I'm like, well, maybe it's your neck that's contributing to that. I'm going to tell you right now what it is. It's always going to be a factor in that. Or maybe it's the opposite side hip. And it has to be from there as well in some way, shape, or form, because every time you walk, you have to swing your opposite side hip with your opposite side shoulder. They go as a pair. Does that make sense? So it was just the aha moment was, let me start where it hurts, and then let me start to look everywhere else. But I was still trapped in a musculoskeletal kind of paradigm, which means that if my shoulder joint hurts, I'm going to look at the joint, I'm going to look at the muscle, I'm going to look at the fascia, all those fancy words that just mean different types of body tissue. But I realized there's a lot of other different systems of the body that can be contributing to that. One is your emotional system and your psychological system, because many people are under so much chronic stress and duress and emotional turmoil and trauma that's causing the inflammation that they're dealing with and the pain. So in my viewpoint now, there's always an emotional component to pain. That's why you're not a rock. You're a human being. So you have to take that into the perspective. Also, like I said before, your story about your prior pain makes a difference on your current pain. But then I started to look at, well, holy cow, there's a lot of other different systems in the body that I'm not paying attention to, like my immune system or my organ systems or my cardiovascular and blood flow systems and lymphatic systems. And that's where I actually found the biggest piece of my missing puzzle is that I was just isolating things too much. That's my biggest thing that I try to change people in, is to expand and look at the body as one single functional unit, because it's not parts, even though that's the way we look at it. And it's okay if you look at parts, and we have to put a kind of a context to how you get your pain. So what I mean by that is this. Uh, Traumatic onset pain is usually uh, easier to get a handle on because you have, okay, A happens where I get hit in the shoulder with a bat. Now I know why my shoulder hurts. So I'm going to look at my shoulder and I'm going to treat the trauma to the shoulder, which nobody does better than traditional medicine, right? But it's that chronic pain that comes on afterwards, or it's the person who didn't have shoulder pain yesterday and today they wake up with shoulder pain.
Yeah.
You have to treat that pain completely different than you did the one that got hit with the bat. Right? You can start initially the same, which is treating where it hurts. And just doing that makes somebody feel better because you're showing empathy and understanding that I see what you're telling me and I'm going to validate where your pain is. But I know without a doubt there's going to be a contributing factor somewhere else. And that's what we have to look for. All right. So my journey for Stop Chasing Pain honestly was quite easy. When somebody comes in to see me and they point to an area that hurts, I know they've typically had everything that you can think of done to that region, all the x-rays, all the MRIs, all the tests and everything, every type of treatment you can think of. I just do the exact opposite. I don't do any of that because if you needed that, you wouldn't be standing in front of me asking me for help. So I'll be honest with you. I don't think that people see me for treatments now. What they see me for is the way I think, how I look at the body. Because if you can figure that out, well, then you'll find the right treatment. You follow?
Yeah.
Because if you're treating the wrong spot, I don't care what you do.
Right. And that's the thing. And we see it a lot at our clinic as well. That is integrative, bioenergetic, all these, we see it as body, mind, spirit. And most people that come in, we're their last resort in a sense. You went to every specialist out there. You've had all the functional lab tests, even everything. And then, you come to us and it's, well, are you going to run the same labs? It's like, well, you've been doing that for how many years now? And how's that worked out? Why would we just do the same thing and expect a different outcome? We think differently. We're looking at root causes. You saw downstream effects. We're looking at upstream effects. We can match the two and show you how that works. But we're not just going to keep casting the line where it's never picked up any fish before. So it is a change, but people are, creatures of habit. So they want the same thing done and done, but they're going to usually get the same results.